This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PH.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPH.D. I'm your host, John DeMasi, with the one and only Dr. Molly FANTASIA, the PH.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Before we go any further, Dr. Molly, we both got the memo to wear green today.
That's right. That's right.
So we're wearing green.
Well, go Eagles, right? Okay. We got to say it.
So we'll mention that so you know that we are rooting for them. It's Health Watch again, and 855-839-1210 is the number in the studio, 855-839-1210. If you have a question at any time for Dr. Molly, or you have a medical challenge that you want to run by her, feel free to call in at 855-839-1210. And as we always do, Dr. Molly, we like to start off by saying, what exactly do you do?
It is so hard to say exactly what we do, but I'll tell you, we do it well.
That's
all
right.
That's the most important thing. Anyway, bottom line is, Innovative Medical Associates is a group of like-minded healthcare providers who operate out of my licensed facility. And we can do anything that a primary care facility can do. The doctor can write a prescription for a pharmaceutical. We can send you out for a radiology. We can send you out for other testing, whether it's cardiology, whatever. That can all be done through our facility and is done. But really, the reason why we all got together and are cooperating in this manner is that we have a belief that we'd like to reduce the amount of pharmaceutical patients are taking. I want to put a caveat to that. I am not telling you to throw away your prescription drugs. When you need them, you need them. But if we can cut down a dosing, cut down the amount of them that you're taking, and augment that with natural substances, that's primarily what we do. If we can help a patient with lifestyle changes, in addition to that, that's what we do. So we all work together to make sure that the patient can go into a health food store, let's say, and pick out some nutraceuticals in addition to the therapies that we use, which is hydration therapy, which is the direct way that we deliver the nutraceuticals.
So why hydration?
Hydration's easy because we're able to give an appropriate amount, and it bypasses the digestive system where you lose some of the amount that we would need to effectuate the change. Remember, John, it isn't enough to say, oh, let's go in and get some blueberries, okay? It's the actual constituent in the blueberries that we're looking for, the antioxidant. So we're able to deliver these things by IV, by hydration, in order to facilitate you really reducing some meds, or in some cases, we've actually been able to help people get off of them.
Well, your blueberries are not exactly like blueberries.
No.
It's a byproduct of that.
Right, exactly.
And it's not, in other words, you could probably
it's
get
like
a case of blueberries.
Right, and eat them till you're... Grape seed extract is a good thing, right?
Yes.
We deliver that. There's a constituent in that is so important and anti-inflammatory. So these are the things that we do.
And with the hydration,
yes,
what can people expect as far as what's in the hydration?
Well,
that depends on, of course, of their condition.
Well, let's talk about what else is sparking us, really being all over the country right now. All these spas banners that tell you, come on in and get your headache remedy, especially tomorrow. Everybody should be in one of those. Not. really, when we look at hydration, we're looking at medical hydration. So when I put together a protocol, I have a patient in mind, I have a solution in mind for that patient, and we want to look at the constituents that actually will help that patient's medical challenge and improve their quality of life. So this is not a Chinese menu. You don't come in and tell us, oh, I want something to make my skin look better. I want a little something for my fatigue. No. What we want to do is we want a patient to come in and really have an evaluation. I want that free consult because we can do it, and possibly effectuate a change that's going to make a tremendous difference in their quality of life.
So how long can a patient expect to be with you?
Probably
as far as
somewhere
hydration?
between 5 and 30 treatments, and maybe beyond that. Some people are, look, you come in for cancer, right? What do you think, John? You're going to be a lifer. You're going to be a lifer. And then, you know what's interesting? People who have these really debilitating conditions, they have other comorbidities. It's amazing. And so I wish I could say I could throw everything against the wall at one time, and we're going to cure your diabetes, we're going to reduce your diabetes meds, oh, we're going to get you walking again like you did your arthritis. No, things take a little time. It's not holy water, that's what I tell you.
People have said to you in consults, well, Dr. Molly, I can do this by going to the health food store.
You can. Good luck.
So talk about that as opposed to what you do.
First of all, you're never going to get enough of the active constituent to change your outcome. I don't care. You can have the best products in the world. And believe me, we're all about taking good products. I am not saying to drop your oral products. I'm not saying that either. I'm saying there are still some good brands out there. By the way, they're getting less and less and less because the larger companies are seeing dollar signs in this, because you had an opportunity to see that in action this week.
Yes.
People go in and buy out the store and then don't get the results they want, and they want to know why.
You know, it's interesting. We should tell this story. So you have a new patient, and she happens to sit next to me, and she's showing me pictures of her nutraceuticals.
Exactly.
There had to be 50 at least.
I would say a little more than that.
More. So I said to her, I think Dr. Molly's probably going to tell you that you should maybe eliminate some of them because they may be duplicating. And you walked in about 5 minutes later and said,
I'm reading your records, and it's really scary to me how much of this is not only duplication, but you may be overdosing on one situation that isn't good. It could be a blood thinner. It has an ability to thin your blood. Now, I'm not saying that, but aren't you on a blood thinner? Well, yeah, I probably would take that out of your protocol.
Yes, so that it's not always what you can get in the health food store.
No, in fact, I would say, John, what you want to do is you want to be judicious in this. I had an interesting conversation with her husband. He said, this sounds like it's going to save me money. No, I'm not kidding.
And exactly right.
And it's probably exactly right. Okay? So the bottom line is that there is a way to approach your oral products, and we will do such a thing. And again, I'm not saying don't take oral vitamins, minerals, and amino acids. I'm saying let's be discriminating in which ones we're doing.
Don't go to the health food store without advice.
Right.
That's really
and
the
you
key.
know that's true.
Yes.
You know that's true.
So, and if you do, you never know what's...
Right. And you don't know what advice you're getting. And remember, nutraceuticals can have side effects too.
Yes.
Just like I said, like one can really be a blood thinner. Well, guess what? If you're on a blood thinner, I want you to be judicious in what you're taking. Okay,
we are coming up on our first break of the morning. The show is called Health Watch, and you'll find us here every Sunday from 8 till 9 right here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio. If you have a question or you have a medical challenge you want to run by Dr. Molly, 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I both return after these words. We are back here on Health Watch, and as always, operators standing by at Innovative Medical Associates, and their number, 856-489-0000. 0505. 856-489-0505. When you call, really what you want to do is make an appointment to sit down with Dr. Molly for the initial complimentary consultation, and you'll get a lot of your questions answered. 856-489-0505. And, of course, the website. A lot of good information on that. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. And Health Watch is the show every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Our number here in the studio, 855-839-1210. If you have a question for Dr. Molly, 855-839-1210. It is Women's Heart Health Month.
Yes.
And
Valentine's Day, of course.
Of course. But the number one killer for women is heart disease.
Yeah, it sure is.
And I mean, it's been that way for a long time.
Right. And it is interesting, isn't it? We haven't really made strides in that direction. But I'm very optimistic right now that, first of all, we have to look at women's health in a holistic manner. By that, I mean the whole body, because women are more complex than men, for sure. And it's interestingly enough, lots of the original heart data that came out was based on studies of men only. It's interesting, right?
Yes.
And it was that way for years and years. The good news is there are become more women PH.D., more women MDs, more women DOs, and as a result, there are more women involved in the research that is being done for women's health in general. But women really have lots of issues in terms that affect their cardiac conditions. For example, women tend to have more autoimmune disease. So if women have more autoimmune disease, what do you think one of the underlying causes is? Inflammation.
Yes.
So women obviously tend to have more inflammation, and that can be a result of hormonal issues, as well as stress issues and how they really relate to stress. And I'm talking about physical stress, by the way. More and more women are in the workforce now with very stressful jobs, but it's how our bodies react because of the hormonal difference that really, it's a real physiological difference. So really, physicians are learning more and more to approach women in a more holistic manner. So one of the things, of course, we use chelation for women, but, chelation is a little different for women. We're still using the chelator, but I don't know if people realize this. You want to use chelation judiciously because it's based on weight. It's based on weight when we calculate the dosing, on kidney function, and some other things. So believe it or not, it isn't one size fits all. And I just had this discussion with another physician who's doing chelation, and they said, you need this many grams to effectuate the change. I would say you do need a particular dosing of the grams, but it's how you deliver it that's going to make the difference for women. And I've seen that firsthand in my clinic.
Is there something you can tell women as far as heart health or in general health?
Sure.
What can they take away from this?
I think they need to make sure that they are going to their physicians. I make sure I have a really good friend of the clinic. We all know I have a good GYN physician who said, what happens? Women in middle age stop going to the GYN. And we know that is a woman, I'm in old age now, baby. And I know how that feels. Most of us don't want to go to our GYN doctor, but they can be a good point for us to go to other physicians. For example, if you need a cardiologist or something. Women don't tend to pay much attention to their blood pressure, and stroke is another leading cause of problems for women. Look at it just in my clinic. And I would say that it's the medications, and hormones have to be delivered very judiciously. Women really have lots of problems during menopause. Of course, estrogen's a big culprit in terms of women's cancers. So there are so many things to look at. So what you want to do is make sure you continue to get your yearly physical, make sure that you pay attention to your body, and I would say you have the lifestyle changes that are necessary to maintain a good, healthy life. That would be eating well. Mediterranean diet is excellent. Watch your carbs, low keto again. We're looking at those kinds of things for women in particular.
So pay attention to just about everything,
You
and
bet.
don't let yourself go.
No, because
to the point where you're
in trouble.
Yeah,
We're in trouble, and you know what? Women tend to do that because their families come first.
How do you combat inflammation though? Because
You and I both know with antioxidants and chelation. See, here's the thing. The other thing is that women don't necessarily show their heart attack symptoms the same way. Men tend to have that crushing pain, women don't. Again, it's hormonal in nature. And women tend to have more adrenal issues, which also can mask the cardiac problem. So again, you really got to watch. And the other thing that's interesting, I find that women try to do much more in the way of crash diets. So they put their bodies into a real quandary because the body's under pressure. They seem to think the crash diet's going to do the trick, and really they need to get some advice with that for sure.
How many diet commercials have you seen on TV?
Well, right now
it's all over.
I would say between January and the end of February, that's all we see. And
yes.
We always are looking at what the ideal woman looks like. I mean, that's the other thing, the body shaming that goes in for women. So women tend to react differently than men about this. Now, we're all for low carb. Don't misunderstand me. But again, you want to use it judiciously, because what if a woman tends to have more of a problem with sugar regulation up and down because of what? The complex hormones.
Can your hydration therapies help in general? Let's say a woman, she doesn't have any of these symptoms or anything.
Yeah, sure.
Can it
right.
help?
We have a wellness program, right?
That's
exactly right.
Wellness program.
I mean, what would we do? We would look at all of their lipids. We would look at their hormonal levels. I, of course, would encourage them to possibly go to a GYN physician or an endocrine physician should their thyroids be a problem. I would look at the natural substances that can help them get through menopause, because, if you don't have good sleep, you're going to feel like heck the next day and maybe ongoing. So there are so many factors, John. It isn't one size for women that fits all, just like it isn't for my men. Men have hormonal problems, but they seem to be a little easier to correct.
What about neurodegenerative disease?
Oh, man, I am really...
How does this come into play?
Well, neurodegenerative diseases are a problem both for men and women, but we will, there are a lot more. I'm seeing more and more women who have come in with diseases that were once usually associated with men. It could be that we're living longer, and maybe that's the issue. But again, heart disease is the number one killer. And what do? We have to watch our lipids. We have to keep the inflammation down. We've got to watch our insulin levels, right? Look at what happened to you. Now, you are a prime case for what men do. Men ignore their blood sugar.
Yes.
Women
Yes.
do that 10 times more. I have never seen anything like it. Wow, isn't that unbelievable?
That's unbelievable.
Women don't, you give the women all the tools to monitor their blood sugar, and they don't do it. Good example of that was my own nurse. My own nurse did it to herself. Okay, so here we are, and she knew better. But again, because we get busy, we're caregivers. You want to know the truth? Women are inherently caregivers for the most part. And so they're caring. They really get out of themselves more than men do. So they don't pay attention to these little subtle changes, whether it's in your blood sugar, your hormones, and maybe you're just feeling run down. Let me tell you, you need to look at chelation. You need to look at hydration, but I'm talking about medical hydration. You want to look at things that can solve some of the underlying causes that can cause a woman to have a heart problem, a problem with the stroke, and the hormonal issues.
What's in the hydration that can really help people?
EDTA is one of the things that I would look at if a woman has a history of cardiac problems, and we've been very successful. What is interesting, if women do the program, they tend to stay on the program. They come in once every 3 months. They get their tune-up. I have a wonderful woman, Amelia, who has been with me since the inception of the clinic with a cardiac issue and pain, also a lot of pain in terms of joint pain, etc., which was rheumatoid in nature. She said, by following our lifestyle program on the outside, which means the diet, the Mediterranean diet, the low lipids, the low keto, guess what? She's in the pink, but she comes in once a month like clockwork.
That's like the new patient the other day who said, how long you been coming here? And I said, 20 years.
I'm going to introduce you to Amelia, right? Because Amelia's been coming here 26 years, among other things. And we have other ones. Look at Pam. Pam, who's a cancer survivor. You're saying, okay, she's on top of her cancer. I agree. But she's also on top of global inflammation.
Yes.
And here's the other thing, one of the things I'm finding, too, is that women who have these dastardly conditions, the autoimmune, etc., they're just inundated with inflammation. Ultimately, I believe that inflammation leads them to having other challenges besides, let's say, the underlying challenge that brought them in to see a physician. So you may have lupus, you may have one of the neurodegenerative diseases. You know what? You need a good cardiac checkup, too, because guess what? You could have some problems.
We are at the halfway point of the show, and that means we've got plenty of time left to take your phone calls. 855-839-1210 is our number here in the studio. 855-839-1210. As I said, the halfway point here on Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, the number 855-839-1210 if you have a question or a medical challenge, 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I are both coming back with more show after these words. Welcome back to Health Watch. Operators standing by at Innovative Medical Associates, 856-489-0505. That number again, 856-489-0505. You can call now and make your appointment to sit down with Dr. Molly, or you can call after we leave you at 9 o'clock, or you can call this afternoon, but call. And that's the number during the week, 856-489-0505, Innovative Medical Associates. And remember the website, innovativemedicalassociates.com. You can find a lot of good information on that as well. innovativemedicalassociates.com. Our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. And again, if you have a question for Dr. Molly or a medical challenge you want to run by her, 855-839-1210 is the number. You want to talk about Alzheimer's, and I understand there's a new blood test.
Exactly, John. There's a brand new blood test. Let me tell you. This is an interesting development, and it was developed, of course, by researchers. And so there is a bunch of PhDs involved. I read the data, and as well as MDs and DOs. But what this is doing is it's looking for a beta amyloid that has been associated with Alzheimer's. And beta amyloid is a protein that has been associated with Alzheimer's disease. It's not the only cause, we've said. But in the past, the only way to really look at someone and say they have Alzheimer's or early onset dementia or any of these types of conditions was to either do the PET scans, which of course are expensive and time consuming, or they would do a spinal tap to look for this beta amyloid. Interestingly enough, as you know, I'm a big believer in biomarkers, and this is the wave of the future, that we're able to really assess through plasma and blood. We're able to assess biomarkers that can contribute to a particular disease. And in this case, we know, and by the way, I've been living with senior moments, People were talking about senior moments. Well, wouldn't I like to know whether I have some early plaquing going on?
Yes.
Without going through a PET scan and getting the radiation, et cetera? Well, this is a way to do it. One of the things that I'm looking at is that for patients, this thing can detect beta amyloid 4240 versus amyloid PET scan status. And an interesting thing is they've shown that this is very comparable to the kinds of things we would get with the PET scan. So this test is very reliable. Now, the question becomes is how do we use this in a clinical setting? Well, I'm lucky. Not only do I have great physicians, but the way we see our patients and the way that they're coming in to do the hydration weekly, monthly, whatever, I'm able to get a baseline on these patients and then look at what? Inflammation. What causes these amyloids? What causes these amyloid plaquing? Inflammation.
So this test, does it predict Alzheimer's?
It can predict. It's one of the ways. It's not the only.
Okay.
It's not the only because we're not sure that beta amyloid is the only reason why people are having this reduced memory and cognition. But we know that it plays a big part in it. We know that. So this can become a way by which we can delay the onset of these cognitive things by what? Reducing your inflammation process. Now, we know that there have been years we've known that lifestyle, meaning there are certain nutraceuticals that can help people's brain function, right? I've talked about this before. All right. We know that multivitamins can do this. We know that magnesium and calcium can do this. We know vitamin D can do it. We know that omega-3s can do it. So imagine having this information and putting together the hydration accordingly based on the amyloid results from this test.
Now, I understand. Am I right? Do you get this test while you're getting hydrated?
Sure. We'll draw the blood and we'll send it out. By the way, it's being done in a reputable lab setting, something everybody knows. I can't say which lab because then the other one's going to get mad at me, and we use both. So the bottom line is this detection is going to be a game changer because why? It can really inform people about potential treatment decisions that they don't have to make in this moment, but might have to make later down the road. And could you imagine if we see the change in the amyloid structure in the blood and monitor this, and maybe a patient doesn't have to develop this type of cognitive deficiency at all? Wouldn't that be wonderful? Don't know it for sure, but it may just be able to do this or slow it down, which would be great.
Can this help with patients who already have been diagnosed with Alzheimer's?
Early Alzheimer's,
Yes.
I would say yes, because it also gives us a baseline, and what it can do is it can put someone back in my chair who possibly is on Aricept or one of the other medications, and maybe we can enhance their outcome by, again, utilizing a hydration protocol that is going to be heavy on the anti-inflammatories and some other things that may have an effect, like choline, which usually you get from eggs, but maybe people don't eat enough or are allergic to them. Okay?
So, yeah, and eggs are expensive these days.
Oh, come on. John, you know what I'm saying.
Yeah.
But I'm saying there are other nutraceuticals and other substances I can put in this particular treatment protocol to help a patient along.
So it's really a process.
Of course. Of course.
And like everything else that you do, it's a process.
Right. And it will be a kind of process that at least we're armed with the information to start. And we can check the progression of looking for this particular protein. That really can make a difference in outcome.
Now, you've always said, and I guess this applies here, you don't cure.
No,
And
no.
So, but to be clear, how much can you help an Alzheimer's patient or early diagnosis
Well, let's
Alzheimer's?
talk about some of the things that PubMed has talked about, PubMed. One of the things, I just saw an article that talked about diet and inflammation and cognitive aging in Alzheimer's disease. Well, if nutrition is known to modulate the immune system and may offer neuroinflammatory process, why wouldn't our protocols help with that?
Yes.
Of course.
Of course.
So this is just another way. The anti-inflammatories may inhibit the neuroinflammation and help a patient, again, help reduce, let's say, I'm not saying to get off of their neuro meds in relationship to Alzheimer's. I'm not saying that because Alzheimer's is a tough disease. But wouldn't it be wonderful to say that we may be able to help a patient and just improve their quality of life? while having this condition,
Yes,
I
yes.
think that's great. Or maybe improve somebody who's having just senior moments, right? I mean, there are I give out neuro amino acids, but now I'm going to actually focus even a little more on the amyloid. Again, we know that nutrition as a whole and functional medicine as a whole can help people who have Alzheimer's, who've been diagnosed with Alzheimer's. So why wouldn't I want to give this a double shot? And I would.
Okay. It is coming up on our final break of the morning, and that means you still have time to get in here with a question or a thought for Dr. Molly. 855-839-1210 is the number. 855-839-1210. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210, WPHT. And again, our number here in the studio, 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I return with more of the show after these words. We are back here on Health Watch. Operators are standing by right now at Innovative Medical Associates. And the number, 856-489-0505. Again, 856-489-0505. Make that call and make that appointment with Dr. Molly for the initial consultation, and you will get all of your questions answered, and hopefully you'll have more information as to whether you want to move forward or not, and that's what you do. Call and make that appointment, 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of today's show, you can catch it again this afternoon. Our Health Watch replay, 4 until 5 this afternoon, here on Talk Radio 1210 WPHT. Health Watch is the show. 855-839-1210 is our number here in the studio. 855-839-1210. Going to talk about some patients, Dr. Molly, and this ALS patient.
Rough.
It's a rough case, but there's been slight improvement so far.
Right. It seems like her children have said that first of all, she's a really lovely person, and she communicates through her kids in a way that I'm able to hear what she's saying, but it does seem like she's getting a little bit more energy from her treatment protocol. But this ALS is really tough. One of the things they said is that she's really been working out with her physical therapist at home, which is absolutely so imperative to keep those muscles going.
Yeah.
And she's just a lovely person, and she was in retail her whole life, side note, and just a charming person. It's only been 2 treatments, John, so as I say before, I really need to have the full 10 in before I can say she's improving or not. And this is a shot. We're taking a shot at this.
But you're seeing slight improvement.
Yes. It seems like she's easier to get in and out of the wheelchair, meaning into a chair, but she needs help, absolutely.
This is one of your toughest cases, I would suppose.
I would say right up there, up there, John, right up there.
And how are the MS patients doing?
The MS patients are doing well. This sort of fits into what we talked about earlier. The MS patients, the Parkinson patients, seem to be doing better. But again, they're doing better in terms of their cognitive abilities. My doc is just going for her PET scan, I believe, this week. I'm anxious to hear those results from her and her lesions. But also our patients have had some good results in the neurodegenerative area, and that's important. So I am seeing results, but it is taking 20 treatments, 30 treatments, and possibly 40 treatments.
I was just going to ask you how many treatments so
far. I mean,
far.
This is not the kind of thing you can say everybody does well in 5 treatments. It's not going to happen.
So you can kind of figure with something like this that it's at least 20, maybe 30.
Right, before we see significant change.
Yes.
And then you're going to have to come back. I mean, the bottom line is the body needs the nutrition, and we have to get the right neuroaminos there to do the trick. Plus, you have to utilize a subclinical dose of a regular drug that we use in tincture. And I would tell you that I'm going to be speaking about that in June to a conference, because we found excellent use of this with our program.
What about the cancer patients?
The cancer patients are doing well. One of my breast cancer patients, she had her PET scan. She comes all the way down from North Jersey, New Brunswick. She had a really good result. Her PET scan and her blood work from her oncologist showed that she had no more growth in the past 6 months, which is good news. In other words, it's the same tumor size, but nothing has spread. That is a positive win for me. The other one is actually we've seen a reduction in her breast cancer tumor.
Now, did you tell me that there's a test that is good as the CT scan? For cancer patients?
Yeah, we have bioidentical. We have biomarkers that we can do. I'm not saying it is as good as, that's a misnomer.
Okay.
I'm saying that used in conjunction with a PET scan, it really does tell me the deal.
Okay. Now, you wanted to go back to this situation.
Yeah, right.
Talking about the Alzheimer's patient and the prediction
reduce, and healthy cognitive aging. I want to end our conversation on the fact that the evidence suggests, there are other reasons to have Alzheimer's, not just the beta protein that we were looking at. No, there are other reasons. So this is just another tool to use. But we do know in the end, it's really all neurodegenerative inflammation that contributes to the memory loss, this kind of thing. So in the end, it would be a good thing if people came in for an early intervention. If you're finding yourself, feeling a little bit like you're losing a little bit of your memory, you forget your keys, all of that kind of stuff that we all do, guess what helps? Come on in. Get some hydration, get some neuroamino acids, get some B vitamins specific for you. Let's put together a program to see if we can help improve that.
And a lot of people just don't do that.
No, because they just think, I'm getting old. Guess what, Dr. Molly, and I think you feel the same way. We understand this. We understand that you're getting old. But, there are a lot of factors that contribute to this. And what we want to do is make sure that we absolutely address these. The other thing, John, don't you know that diabetes blood glucose is one of the things that causes this inflammation? So people who have diabetes, they should be calling my office for a free consult, because guess what? They're at risk for having neurodegenerative changes.
And I am the poster boy for that.
Oh my God! Well,
remember?
I do remember. Believe me, I want to forget, but I do remember. So what I'm saying is, in conclusion for this, remember, this all goes back to the inflammation process in our body. And it's got to hold it down. As I told you, it can be good, it can be bad. You want Goldilocks.
How can you get people to really address these issues?
We're trying. We're trying
right here. We're here trying, yes.
We're here trying. But I am finding that more and more specialty physicians are sending people back to have them really look at medical hydration, not spa hydration, medical hydration as part of the toolbox. And I think that it really does work. I'm getting more and more referrals from physicians. So I would say that it's being patient driven because they're frustrated. How much medication can I be on?
Yes. Yes.
Right?
I mean, how many people have come to you with 17 or 18 pills?
Right, in addition to all the nutraceuticals.
Right.
So the idea is you want to look at what kind of quality of life changes that we need to help you with too, including eating the Mediterranean diet. Also, I want to tell people, we've got to look at gut health. We don't do enough of that. We're big proponents of enzymatic therapies, taking, really good bioidentical enzymes that you can get at the health food store. We want you to do some fasting if you can. I was on you about it.
Yes.
We have to do it safely, though, not these crazy diets that people are on, but safe fasting. You know why? As we get older, it takes a lot of cellular energy to digest. That's why you don't eat at night, guys.
Yes.
Okay,
Words of wisdom. With that, we are going to put the wraps on another edition of Health Watch. Don't forget, Dr. Molly Fantasia is available for a consultation during the week or any time that you can do that. 856 856-489-0505 is our number, 856-489-0505. The website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And don't forget, if you missed any of today's show, you want to just hear it again, we are on this afternoon from 4 to 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff Barbara, Lana, and Catherine, and Donna, and of course there's fabulous Fran, and there's Joanne, and delightful Dee, and our medical assistants Sandra, and caring Kathy. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week. We'll do it all over again next Sunday, Health Watch, 8 till 9 here on Talk Radio 1210 WPHT. And of course, go Eagles. Take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.